Okay, welcome. Hi, everybody. I'm Dr. Garcia Webb. Welcome to my weekly Facebook Live where you can ask me any kind of question as long as it's not a personal medical question, but I do education, myth busting, all the things. So we'll talk about whatever you would like to talk about. Just don't ask me direct personal medical questions. And other than that, everything's fair game. I also have a private practice, a concierge weight medicine practice in Massachusetts. So if you're interested in working with me, I will leave that info down below. And if you're outside Massachusetts, I also do life coaching with regards to goal formation and habit formation. So if you're interested, let me know. But today we're going to talk about these great questions that you guys have. And if you have questions after this, or you have a follow-up question to anything that we went over, you can always leave it in the comment section down below or message me wherever. Or you can leave it on my YouTube channel. I have a YouTube channel, Weight Medicine with Dr. Meghan. Okay, so getting started, first question is, how long can one expect to have side effects on the onset of the lowest dose? This is for somebody who's on Mounjaro. My doctor had me skip this week's dose because it caused such a detox effect. I had to take a GI detox binder to control the effects. I'm not sure what that is. Okay. All right, so broadly, in terms of side effects, it's very patient dependent. If I'm working with somebody and they had side effects on the lowest dose, because these medications work so well, usually the patient wants to really give it a shot before throwing in the towel. So usually, you can take a week off, but if it's the lowest dose, oftentimes I will also try to manage the side effects because sometimes these side effects go away. And so what I would hate for somebody to do is to go through all the the hoops of getting something approved, finding it, getting it to their house, and then just throwing in the towel after one or two doses when, it might be that they have significant side effects to begin with, but they taper off over time. So that's always the goal with any of these for people who have those really severe first one or two dose side effects. And I've definitely had patients who feel like they had food poisoning. That can happen. I would say, it's unusual, but it does happen. So yeah, I would try to manage the side effects with other medications, or making sure you're having really small bites of food, like making your meals a lot longer sometimes can help. So really just giving your stomach a longer time to process the food, that can be very helpful. Not eating in a rush, really planning out your meals, maybe doing a protein shake. Those are all ways that you can try to mitigate these side effects sometimes. But yeah, in terms of when do you call it, that again is also the patient's call. So I think if somebody, if it's really interfering with your quality of life after, several weeks, then you really have to wonder, and you're not getting, so sometimes people get, they can kind of do well with, Zofran or Imodium or what have you. Sometimes they can kind of get by and it buys you a little more time, but really depends on your quality of life as well. So it's very patient dependent, but I would definitely give it more than one or two doses for anybody that I was seeing for this issue. Yeah. Okay, next question. I have horrible side effects. Oh, okay, this is the theme of the day, is side effects. Also, the last person was on Mounjaro, I should say, and this person is on Mounjaro. Okay. It's horrible. I have horrible side effects, extreme tiredness. I slept 3 days in a row. I missed work. I've been puking. I've been on it since December. I had to stop. Yeah. Yeah, sometimes people just stop. And I think especially for those people that you're not able to really achieve good quality of life with other supporting medications or lifestyle tricks like what I just talked about, it is sometimes it's just not the right fit for patients. And but I will say that, you know, the good news is that it's not true. Just because somebody didn't do well on Mounjaro doesn't necessarily mean that they won't do well on semaglutide or liraglutide. So I definitely wouldn't rule out everything as a class for people who have severe side effects, because I've definitely had patients switch. You know, some people do better on Saxenda, some people do worse on Saxenda. You don't know until you try. So you just have to be willing for this to be, you know, a period of uncertainty. But the goal is always that you're finding something that you can be on lifelong. So it may just take a little while. And it's kind of the same for any medication that we start people on. For people who have diabetes or people who have a high blood pressure or high cholesterol, you know, we don't always get it the right fit at exactly the first try. And that's just pretty normal. So it's just in this case, the side effects can be pretty extreme for a small percentage of patients. I definitely don't have a lot of people who have that kind of like food poisoning reaction, but from time to time it does happen. Okay, so next question. The first day some of these I'm like paraphrasing them because I don't want to make them too personal. The first day I take this, I feel so tired and I'm burping. After that, I'm good for the rest of the week. Yeah, that's another great point, which is sometimes when people are getting used to their medication, they really have a good sense of when they are going to have those side effects. So especially for people who had a bad reaction that first dose or that second dose, you may notice that over time you can kind of predict when the side effects are going to happen within that first, you know, 24 to 48 hours. And so sometimes that makes it a lot easier for patients too, because it just becomes a bit more predictable. So it's, you know, this is that, you know, day one is when I take the medication to help with my nausea or what have you. So so that can be really helpful and make things a bit more manageable for people. So yeah, great point. Okay, so next one, these are all about Mounjaro. Okay, weather the storm for 8 years until Wegovy goes generic. No thanks. Patients should try everything they can prior to semaglutide, but the reality is for people that are 200 plus pounds overweight, they have already spent their lifetime trying all these things without success. Okay, maybe this person isn't on Mounjaro. Maybe they're on Wegovy. Regardless. So, yeah, I think, you know, in an ideal world, I would love for people to have really optimized their lifestyle and have it exactly how they want. And then that's a really good indicator of, okay, now, if your BMI hasn't really responded, but you're eating how you want to eat and you're, you know, exercising how you want to exercise and all that's really in place, you kind of done your part. And so whether your BMI responds or not to those changes is a very helpful indicator in terms of, you know, is this person someone who would really benefit from medication long term? So if you have, you know, had a BMI of 35 and you changed all the lifestyle options in terms of eating, sleeping, exercising, all those things are how you want them, but your BMI has only come down to like 33, you've really kind of exhausted what you are capable of doing lifestyle alone. And so that's always a great indication of, okay, this is somebody who likely would really benefit from a medication to augment the effects that they're already getting. And you know, when you put those things in place anyway, you are going to feel better. You know, if you're exercising regularly the way you want to exercise, chances are you're definitely going to feel better. It's just mentally frustrating for people when their BMI doesn't necessarily reflect that. And so that's why I feel that we are so lucky now that we are living in this time when we have these tools and they can be so beneficial for people, because there are definitely people who are doing all the right things and they're just they're not seeing the change in their BMI. So yeah, I agree. It would be great if people have optimized that before they start medications, but I also think sometimes people are really kind of mentally beaten down by all the changes that they've tried to make that haven't worked. And so some people have so much frustration and just feel so kind of hopeless about their weight that, I don't always wait for people to have their lifestyle optimized before starting. And it really depends on the patient and what they are looking for. But it's, yes, I would love everybody to have all the lifestyle things set up and just how they want them. But for some people, there's a lot more behind that that's really interfering with it. And so I think the medications can kind of help jumpstart those lifestyle changes, because they are, when people see that movement of the scale, that can really energize them from a mental perspective and help them commit to those lifestyle changes. So I think it's not a clear-cut answer, but I think everybody comes to a weight issue from their own personal place, and so their solution is going to be different as well. Great questions. Great questions. Okay. Now, okay, this is about eating habits. Okay. If I let myself eat what I want for a few hours, I get into trouble. So is intermittent fasting good for someone like me or not? I don't know. I mean, I think the key with intermittent fasting, like any other lifestyle change, is, do you want to do it forever? Because people get really hung up on this idea of medications are forever, but we really shouldn't forget that actually anything, any lifestyle change should be you should go into it with the idea that that's forever too. So, because when we stop making the lifestyle changes, like, they don't work either, right? If we exercise consistently and then we stop, we're no longer really going to continue to get the benefit of exercise. So, and that I think goes for eating habits as well. If you are eating how you want to eat, and that includes intermittent fasting, and you feel like that is liberating and takes a lot of decision making off your plate, and it feels helpful for you, and it's not kind of increasing the amount of mental drama around food, then I think that is definitely something that is, that might be a great fit for you. I mean, the key with anything weight related is it's very heterogeneous. So what fits for somebody is definitely not what is going to fit for everybody. But so a lot of it is just, trial and error. In the same way that exercise is trial and error, finding what works for you. And sometimes these things change over time too, which is fine. But I think if you feel better when you're intermittent fasting, if it helps you, and you can think about doing this for decades, if you can think about doing this when you're 80 and you feel like, oh, that's great, not a problem, then I would do it. If you think about doing it when you're 80 and you're like, I'm not going to make it that long, then I wouldn't even start. There's other ways, so you don't have to try to fit into any type of, eating mold to be healthy. Okay, that was a great question. How is exercise measured? What are the parameters? Okay, so in general, we think of exercise in terms of cardiovascular exercise. The goal is really 150 minutes per week of moderate exercise, meaning you could carry on a light conversation while you're doing it, or 75 to 90 minutes of vigorous exercise, meaning you could not carry on a conversation while you're doing it. That's for cardio. And then strength training, a good goal is 30 minutes twice a week. Yeah. So, and then I think also it's important to make sure you're doing some sort of yoga or Pilates or some sort of core strength in terms of, back health, core health. That's really important just long term. I can't tell you how many people that I see in the office who just, were reaching for something and then they felt a tweak in their back and then they're miserable for the next week and a half. So you really want to strengthen your back as much as possible as well. Can you lose weight with just strength training? Do you have to do cardio? I mean, usually, traditionally, and I'm summarizing because I don't have the studies in front of me, but in general, what we know about exercise is that it tends to help with weight maintenance, but it's not kind of the end-all be-all for weight loss. So, but it is so good for so many things, cardiovascular health, mood, and weight maintenance is one area where exercise is really important. But I think, somebody should not, I wouldn't have the idea that like, oh, I can sign up for a marathon and I'm gonna like not have to do anything else. I think it's more in terms of helping you continue a healthy lifestyle. So can you lose weight with just strength training? I wouldn't, I would do a mix of both. I mean, both are really important. Cardiovascular exercise is really important for heart health, so many things. And strength training is super important, especially for women. I feel like men, have gotten the message over their life of like what it, going to the gym and getting strong and how important that is. And I think, it's only within the last, decade or two that women have really heard that message as well in terms of what's so important for our health and our, bone strength, muscle strength, all these types of things. So strength training is super important for everybody, but I would really aim to do a mix of both. If you don't like cardio, I think there's definitely a type of cardio for everybody. So it might be that you just haven't found it yet. Some people really like high intensity interval cardio. Some people like long walks. There's so many different ways to get cardiovascular exercise. So I would definitely, if you're not doing it, I would look into maybe some options that you haven't explored first. But I think that's kind of the theme of the day is side effects, and then just this is an iterative process and you really have to find out what works best for you, and also be open to the fact that that might change over time because we're always growing and evolving. So anyway, I hope this was helpful for you all. Thank you so much for watching. I'll have the replay up on my YouTube channel, and thanks so much. Bye.